Welcome back to another episode of Hallis City Podcast. Today's podcast, we're talking about cancer and radiotherapy, a subject that people often find worrying, have a lot of questions about, and they're not sure about. Today, I have Dr. Rana to talk to us about radiotherapy and cancer today. Doctor, what do you do at City Hospital?
I'm a radiation oncologist. I trained in UK. I have 20 plus years of experience of managing cancer patients with radiotherapy. And I have a specialist interest in developing advanced radiotherapy techniques, especially brachytherapy and highly focused stereotactic radiation. So I've just moved to Dubai to work at Mediclinic City Hospital about 3 years ago, and that is where I'm currently based.
So I think a topic people want to understand, what is radiotherapy?
Radiotherapy is basically just shining X-rays onto the cancer with a very high precision to clear that cancer. So most of the cancers we treat with chemotherapy or surgery will require radiotherapy at some point in their life as well.
So when we talk about cancer, what sort of cancers are we talking about that you're likely to treat?
When we look at the statistics, 4 out of 10 curable cancers, when they are cured with surgery or chemotherapy, will have radiotherapy as part of their package. And 8 out of 10 cancer patients at some point in their life will have radiotherapy treatment. So radiotherapy is actually much more common than what people think as a cancer treatment. And this is one of the most economical and cheap treatment as well, both in terms of cost and in terms of side effects. So there are several cancers which we treat with radiotherapy. More important cancers where we actually can save the organs without sacrificing that organ. That is the success of radiation treatment, namely with the voice box cancers, where it historically used to be removal of the voice box if you have a cancer there and losing your voice. Nowadays, no, you can just clear that with radiotherapy. Bladder cancer, you don't have to remove bladder, you can and don't end up having a bag. You can just give radiotherapy to clear bladder cancer. The cancer in the anus or the back area, you don't have to cut it out and the bag there forever. You can just clear that with radiotherapy. Include even breast cancer, you don't have to clear, surgically excise the whole breast. You can just take the lump out and remaining breast can be treated with radiotherapy. So save the organ and still achieve a high percentage of cure. That is the purpose of radiotherapy.
I suppose as a layman person, I suppose people don't realize that. And I think technology, as things have advanced, you can know, a lot of people think you have to have the organ removed and the advances in this. But let's talk about side effects, because I think a lot of people from TV have seen horrific side effects with things like cancer treatments. And what sort of side effects do we see in radiotherapy?
So radiotherapy is in practice for more than 100 years. So imagine that even 30 years ago, the computing was so ancient in the last century. In the last couple of decades, computing, software and hardware, especially with the introduction of AI, has advanced so much that radiotherapy, which is a very technologically driven treatment, can be so focused onto the tumor without giving any significant dose to the surrounding sensitive organs, that side effects nowadays are really infrequent. Yes, there are side effects, and that is what we talk about with the patients. But in the given context of curing cancers compared to surgery or other treatments, the side effects are lesser, but a different type. And there are expert teams available to manage those side effects. Most of the patients who get curable treatment delivered with radiotherapy will have that delivered without any significant side effects. So the risk of having side effects are really less than 5%.
I think that's what people want to understand, Doctor. I think side effects is one of the biggest, scariest things for patients, and I think it's nice to hear that is very low. So I know that you also specialize in brachytherapy as well. What is that?
So as I said, that radiotherapy, the purpose of radiotherapy advancement is to focus the radiation onto the cancer without letting it spill onto the sensitive organs. How well this will perform if you can insert radiotherapy directly into the cancer, which will have the least spill onto the surrounding organs. And that is what is called brachytherapy, which basically the Latin word means treatment of radiotherapy from inside or from near. So we use several techniques where we can put radiotherapy directly into the cancer without any significant risk of damaging the surrounding organs, and that is what is called brachytherapy.
So different from the radiotherapy, so it's inside, so obviously the radiation for the radiotherapy is obviously outside. And Is there any side effects with the brachytherapy or to the radiotherapy?
So any cancer where you can access the tumor to place your radiotherapy needles or seeds directly into the cancer will be suitable for brachytherapy. And brachytherapy is going to provide the highest concentrated dose into the tumor without the chance of spilling it onto the surrounding sensitive areas, so bringing the least side effects. So the most common cancer which we treat here in Mediclinic City Hospital with brachytherapy is prostate cancer. So men who have prostate cancer, they have options to have surgery, radiotherapy, or brachytherapy. So surgery is available, radiotherapy is available in many centers across the country, but brachytherapy is a very special technique which is only available in Mediclinic City Hospital, where we insert radiotherapy directly into the prostate. It's just a day procedure, either one session or 2 sessions, as opposed to radiotherapy, which is every day, Monday to Friday for 1 month to 2 months. So there are definitely benefits for having brachytherapy, and we do treat people who come from everywhere in the country or even outside the country to have prostate brachytherapy as a treatment to cure their cancer with the least side effect and the rapid recovery times.
That's an amazing sort of an advancement for a prostate, and it's obviously because there's a lot of focus on different cancers, and I think prostate often tends to be mislooked at. But what other cancers could brachytherapy also help with?
So in our part of the world, we also see advanced cervix cancers. So young women who develop cervix cancers, their cancers can grow outside the cervix. And that cancer will require a very high dose of radiation to clear that cancer. From external beam radiotherapy, you cannot give that high dose of radiation. You must give brachytherapy to achieve that high dose and cure that cancer. And that brachytherapy most likely will require even more advanced version, which is using needles inserted directly into the cancer. And that type of advanced hybrid brachytherapy, again, is only available in Mediclinic City Hospital. So the people who come here for the treatment with for cervix brachytherapy, they come everywhere from the country, from many other centers where they do brachytherapy, but this type of advanced brachytherapy, where you have to put directly needles into the tumor, that is where we specialize as well, to achieve that high percentage of cure with the least side effects.
So summing up brachytherapy, we've discussed prostate, cervical. So the benefits really sound great. I mean, what other benefits do you get with this treatment? You've obviously said it's more, less patients have to come every day, it's less risk, and obviously less side effects. But what else would you say is a benefit of brachytherapy as a take-home message?
Not every patient is suitable for brachytherapy. So this is why when we get a new referral, we take the patient's case through a tumor board, which comprises of surgeons, oncologists, radiologists, pathologists. The whole tumor board will review the case and see the eligibility or suitability for brachytherapy. So this is, again, in Mediclinic, we have set up these type of tumor boards where we select patients. And if the patient is selected for brachytherapy and the patient is suitable for brachytherapy, then of course there are several advantages, that you are going to give eventually a very high dose of radiation directly delivered into the tumor with the least spill outside. This is the ultra precision treatment. So the side effects are supposed to be really minimal, other than the procedure related possible side effects, because you are actually technically invasive procedure. You are inserting the needle or something into the tumor, which could cause in some patients a little bit of bleeding or pain, which is very manageable kind of side effects, like a biopsy, like people do that. So that kind of thing. It's not a big cut or big surgery or that kind of thing. So in patients who are suitable for brachytherapy, there are lots of advantages, and that is why people come to Mediclinic City Hospital to have their cases reviewed for the suitability of brachytherapy.
Thank you so much, Doctor. I think it's been an enlightening podcast to learn about so many advancements that are happening. I think what a message for patients out there, that when you come here at City Hospital, your case is evaluated by a complete specialized team in an MDT, looking at whether the right treatment for you and how we do that. And today, I think we've taken some myths away about radiotherapy and some scare stories that you may have seen in the press. Well, Doctor, it looks like your team have got it really covered when it comes to managing a patient and what they need here at City Hospital. Thank you for your time today, and we really appreciate it. Thank you for joining us on this podcast today, and we look forward to seeing you next time.